This is the mediastinal surface of the right lung. We can see the oblique fissure. We can see a partial horizontal fissure, although it does not continue all the way, dividing the right lung into a superior, middle, and an inferior lobe. We have an inferior border, and contained within this is the diaphragmatic surface, and we also have an anterior border. You can see the apex of the lung and the hilum of the lung. We have two pulmonary veins. The one going to the inferior lobe is rather abnormal or unusual. It's quite inferior. And we also have pulmonary arteries relaying deoxygenated blood to the lungs. And we also have the right primary bronchus that bifurcated in two. There's also a very small cardiac impression. It's usually associated with a portion of the superior lobe and the middle lobe. The groove for the superior vena cava is situated here, and the azygous vein with its arch will be there.
This video was partially sponsored by Dirisana Plus, an EU-funded project.